So, have you ever really stopped to think about why the shoulder is so prone to injury? Well, in this explainer, we're going to dive right into that. We'll look at the shoulder's kind of paradoxical anatomy and walk through the key clinical tests you need to know to diagnose dislocations and rotator cuff tears. Honestly, this is bread and butter stuff for anyone interested in orthopedics, so let's get into it.
All right, so here's how we're going to break this down. First, we'll tackle the anatomy that makes this joint so unstable to begin with. Then we'll get into the specifics of assessing for impingement, followed by how to test for gross instability. And we'll wrap it all up with the key clinical takeaways you'll want to remember.
So, let's start with the big question. Why the shoulder? What makes it the problem child of the musculoskeletal system? Well, it really all boils down to a pretty fascinating trade-off in its design. Yeah, that's right, the most common. Think of the shoulder joint like a high-performance sports car. It's built for incredible range of motion, for agility, for speed. But that same design that gives it all that freedom, well, it also makes it pretty fragile. One bad move and you're looking at a serious breakdown.
This right here is the heart of the issue, mobility versus stability. You've probably heard the golf ball on a tee analogy, and it is spot on. The shallow glenoid socket is the tee, and the big, round humeral head is the golf ball. It's a setup that gives you amazing movement, right? But it's also just inherently unstable. Now, when you see a patient with an acute shoulder dislocation, the signs are usually pretty hard to miss. You'll literally feel a void where the humeral head should be. You'll see this prominent bulge at the front of the shoulder, and the patient, they'll be cradling their arm, their face just a mask of pain. It's a classic picture you're not going to forget. And when this happens, time is absolutely of the essence. The longer the shoulder is out of place, the more damage can occur. And trust me, trying to reduce it without proper anesthesia is just a recipe for disaster. The muscles are in complete spasm, they're fighting you every step of the way. So anesthesia isn't just for pain control here, it's what makes the reduction even possible. Okay, so we've covered the basics of dislocation. Now let's switch gears and talk about impingement. This is where your physical exam skills are really going to shine. We're going to look at a couple of key maneuvers that'll help you zero in on what's going on.
Here is a huge clinical pearl for you. Remember this for your exams. The Neer test is your go-to for rotator cuff issues. Why? Because it's so sensitive. That means if the test is negative, you can be pretty confident that the patient does not have a supraspinatus tear. It's an awesome screening tool to help rule things out.
So how does the Neer test actually work? It's pretty clever. By forcing the arm up into flexion, you're essentially creating a traffic jam in that subacromial space. The rotator cuff tendons get squeezed between the humerus and the acromion, and if there's any inflammation or tearing in there, yep, it's going to be really painful for the patient.
Then we have the Job test, also called the empty can test. This is another fantastic tool. But unlike the Neer test, which is more of a screening tool, the Job test is a bit more specific. It's designed to put the supraspinatus muscle under maximum stress. So if this test is positive, you can be way more confident in your diagnosis of a supraspinatus tear.
Now this is where things get really interesting. See this range of motion right here? 60 to 120 degrees. This is like the danger zone for the rotator cuff. And there's a very specific anatomical reason for that. This is what we call the painful arc of impingement. So below 60 degrees, everything's usually fine. Above 120 degrees, the coast is clear again. But right in that middle range, that rotator cuff is getting pinched with every single movement. It's a classic sign you should always be looking for.
All right, we've talked about what happens when things get too tight in the shoulder. So now let's flip the script and talk about the opposite problem. What happens when things get way too loose? This sulcus sign is just a dead giveaway for a loose shoulder. When you gently pull down on the arm, you'll see this little indentation, this sulcus, appear right below the acromion. It's almost like the shoulder is literally sagging out of its socket. This tells you the ligaments that are supposed to hold everything together, well, they're stretched out and just not doing their job. The apprehension test is all about reading the patient's reaction. As you gently move their arm into a position of instability, you'll just see this look of, well, apprehension, even terror on their face. They will physically try to pull their arm away from you. It's not just about pain. It's about the fear of their shoulder popping out of place again. It's a powerful and very real feeling for them.
Okay, let's bring all of this together. Here are the most important high-yield points you need to have locked down for your exams and for your clinical practice. So let's recap. The big takeaway,
High mobility equals inherent instability. It's the fundamental trade-off. Second, know the difference between your tests. Impingement and instability are two separate issues. Remember, the Neer test is your sensitive screening tool to rule things out. For the apprehension test, it's the patient's feeling of instability, not just pain, that makes it positive. And finally, that painful arc between 60 and 120 degrees, that's a classic can't-miss sign of impingement. If you can remember these points, you are well on your way.
So, there you have it, a crash course in the shoulder exam. But, the physical exam is just the first step. The real art of medicine is figuring out what to do with that information. So my question to you is, what's your next move? What imaging are you going to order, and why? That's a question you'll be answering for the rest of your career.